Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, let's try and unpack this. Picture this. 2 out of every 3 children under 5 in countries often called low and middle income are exposed to physical punishment.
That's a huge number.
It really is a staggering statistic from the sources we're looking at today. And, what do the findings tell us about the consequences? Well, this major new analysis suggests the outcomes are exclusively negative.
Yeah.
Welcome to the deep dive. Today, we're digging into a topic that's undeniably global, the effects of physical punishment on kids and adolescents. And we're focusing specifically on some crucial new findings coming out of low and middle income countries, areas often, underrepresented in this kind of research.
That's exactly right. This deep dive is built on a very recent, very comprehensive analysis. It was published in Nature Human Behaviour.
Okay.
And we also looked at their protocol, the paper outlining exactly how they did the work. Together, these sources synthesize findings from studies across 92 different low and middle income countries.
92. So our mission here is pretty straightforward. We're going to walk through what these sources uncover about the links between physical punishment and outcomes for young people and even adults in these settings.
And crucially, why these findings matter.
Yes, why they're so vital, not just there, but, everywhere people are trying to support kids' development.
Okay, so physical punishment. The sources define it as using physical force intending to cause some pain or discomfort to correct behavior. Things like smacking, shaking, spanking.
Right, common examples.
And it's widespread globally. It's a practice with, deep historical roots in many places.
And it's definitely been on the international radar. I remember back in 2006, the UN Secretary General actually called for a worldwide ban on corporal punishment.
That's right. And since then, over 60 countries have brought in bans, full or partial. But, as the source points out, most of those bans, they're in wealthier, high-income nations.
Which leads us to this specific idea researchers have talked about, right? The cultural normativeness hypothesis.
Exactly. The thinking there was, maybe physical punishment has different effects depending on how common or, socially acceptable it is in a specific culture.
Okay, so the idea was, if it's something almost everyone sees or experiences, does it somehow, lose some of its harm? Does the social setting change the impact?
That was a hypothesis, yeah. But a big challenge in testing it properly was just the lack of solid research data, specifically from these low and middle income countries, where the practice is arguably most common.
So the earlier research was skewed.
A lot of the big analyses, were heavily weighted towards data from wealthier places.
And that's precisely why this new analysis is such a big deal. Its main goal was to specifically gather and synthesize the evidence only from those low and middle income countries.
Where most kids live.
Exactly. Where most of the world's children live and where physical punishment is known to be very common. They really wanted to fill that gap, give voice to the data from these underrepresented regions.
And they used, rigorous methods. It was a systematic review and a meta-analysis.
Okay, break that down simply.
Sure. Think of a systematic review as like a super careful search. You set clear rules to find all the relevant studies on a topic.
Got it.
Then the meta-analysis takes the actual data, the numbers from all those studies, and combines them statistically. This gives you a much stronger overall picture than any single study could on its own.
So they weren't doing new experiments, but analyzing hundreds of existing published studies.
Precisely. They analyzed 195 studies published between 2002 and 2024.
Wow.
Yeah. And these studies covered 92 distinct low and middle income countries. They focused on quantitative studies, the ones with numbers looking at the association, the link between experiencing physical punishment in childhood or adolescence, and various outcomes later on.
And I noticed the protocol mentioned searching in multiple languages, English, Spanish, Portuguese, Arabic, Chinese. That feels really important for a global analysis like this, right? To catch research not just in English.
Absolutely crucial. That wider search helps get a much more complete view of all the evidence out there, especially from regions where research might be published locally.
Makes sense.
And on the stat side, they use methods like multi-level random effects models. Without getting too technical, it's basically a smart way to analyze data when you have findings from lots of different studies, and some studies might report on several outcomes. It accounts for that complexity.
Okay.
And importantly, their analysis included physical punishment happening both at home and in schools.
Right. Okay, so they pulled all this data from studies in 92 countries. What specific things were they actually looking for? What kind of outcomes did these studies measure?
They looked at a really broad range, 19 different outcomes in total. The sources kind of grouped them. So they looked at relationships, especially that critical parent-child relationship.
Okay.
They examined both mental health and physical health outcomes.
So things like stress, anxiety, maybe even specific physical health issues.
Exactly. And a big chunk related to behavior. Things like violent behavior, attitudes towards violence, substance use, overall behavior problems. They also broke down behavior problems into internalizing, withdrawal, depression, and externalizing like aggression, destructive behavior.
That covers a huge spectrum of how a child might act or respond. What about skills and development?
Yep, they looked at several developmental areas too. Cognitive function, social emotional skills, language skills, executive function, that's key for planning, self-control, memory.
Right, those higher level skills.
Also early child development more broadly, and motor skills.
Yeah.
And then two others, quality of sleep and whether a child was involved in child labor. So a really thorough list, trying to capture many facets of a young person's life.
Okay, so after gathering this massive data set, nearly 200 studies, 92 countries, looking at these 19 outcomes, what did the analysis actually show? What was the headline finding?
Well, the main finding is incredibly consistent and frankly quite powerful. Physical punishment was significantly associated with negative consequences in 16 out of the 19 outcomes they studied.
16 out of 19, well, that's almost all of them. Can you give us some examples of those specific negative outcomes they found links to?
Definitely. The analysis showed significant links between physical punishment and worse parent-child relationships, a higher chance of being a victim of violence, and a higher chance of perpetrating violence later, including intimate partner violence in adulthood.
So it's linked to both experiencing harm and inflicting it later on.
Correct. Other negative outcomes included approving of violence, physical health problems, mental health problems, substance use, poorer academic outcomes, impaired language skills, impaired executive function, impaired social emotional skills. And on the behavior side, overall behavioral problems, internalizing problems like withdrawal and anxiety, externalizing behaviors like aggression, impaired early child development, and poor quality of sleep.
That list, it covers almost every major area of healthy development you could think of. It's really extensive. Now, you said 16 out of 19 showed negative links. What about the 3 where they didn't find a significant association?
Right. Also important to note, the study found no significant impact, positive or negative, on cognitive skills, motor skills, and child labor. For those 3 specific outcomes, the meta-analysis didn't find a clear, statistically significant link either way.
Okay. And here's what feels like the absolute crucial point from the sources, the one that really hammers it home. The analysis found 0 positive outcomes associated with corporal punishment. None.
Not a single one across any of the 19 outcomes studied in these low and middle income settings. That's the undeniable finding.
Yeah.
And the lead author, Jorge Cortas, is quoted emphasizing this, that the consistency and the strength of these negative associations across such a diverse range of countries strongly suggest that physical punishment is, well, universally harmful.
Universally harmful.
Yeah. He highlights that these results line up very closely with what studies in wealthier nations have found, too.
So that idea we mentioned earlier, the cultural normativeness hypothesis, that maybe the harm is different where it's more common, this huge analysis seems to directly challenge that.
It really does.
It suggests the negative impact is pretty universal, regardless of how common it is culturally.
That's the strong implication, yes. The consistency across all these different settings suggests the basic ways physical punishment causes harm seem to operate similarly everywhere.
Let's touch briefly on those mechanisms then. The sources mention some theories about why physical punishment might lead to these problems. Can you break those down simply?
Sure. The sources point to a few well-established ideas. One is social learning theory.
Okay.
Basically, when caregivers use physical force, they are, maybe unintentionally, modeling aggression as a way to solve problems. Kids learn by watching.
Like, this is how you handle things when someone does something you don't like.
Kind of, yeah. It can teach them that aggression is a legitimate response. Another angle is attachment theory.
Right, the parent-child bond.
Exactly. Physical punishment, especially if it's harsh or happens a lot, can really damage that crucial secure bond between a child and their caregiver. That bond is fundamental for feeling safe, and eroding it can seriously impact social and emotional development. Then there are neurodevelopmental models. These suggest that experiencing physical punishment, which is often scary for a child, can actually affect how their brain develops.
How so?
Specifically, it might impact brain networks involved in processing threat and stress. This could have long-term effects on cognitive and social-emotional skills, especially if it happens frequently or early in life when the brain is, most adaptable or malleable.
So it's not just about the immediate pain. It might literally shape the developing brain and how a child sees the world, relationships, threats.
That's the thinking, yes. And putting these findings in a bigger context, they really align strongly with the United Nations' long-held position
Which is?
that physical punishment is a form of violence against children and a clear violation of their human rights.
And preventing it is actually part of the UN's Sustainable Development Goals, right? Those goals focused on ending violence against children.
Precisely. So this robust, data-driven analysis from 92 countries provides really powerful evidence to back up those global efforts. It's crucial for informing research, guiding policy, developing effective programs, basically protecting kids.
Now, with any big synthesis like this, there are always challenges, limitations. The sources seem pretty upfront about these. What makes it tricky to draw absolutely definitive cause and effect conclusions, even with so much data?
Well, the main limitation, and this is true for almost all research in this area, is ethics. You simply cannot do experiments where you randomly tell some parents to use physical punishment and others not to.
Right, of course not. Unthinkable.
So almost all the research available, and therefore what's in this analysis, is observational. These studies look at relationships between things like punishment and outcomes. The challenge is accounting for confounding factors.
Okay, explain confounding factors in this context.
Sure, it's anything else that might influence both whether a child gets physically punished and the outcome you're measuring, like a parent's own stress, their mental health, the family's income, maybe even the level of violence in the community.
Okay.
All those things could be related to both whether a parent uses physical punishment, and they could also directly impact the child's behavior or mental health, completely separate from the punishment itself.
I see. So if a study doesn't perfectly account for those other factors, it might look like the punishment is causing the problem when really it's that other factor or a mix of things.
Exactly. The link might be real, but figuring out how much is caused just by the punishment is tough. The researchers acknowledge that if confounding factors aren't perfectly controlled in the original studies, it could potentially inflate the estimated link between punishment and negative outcomes.
Makes sense.
They also knew going in about other limitations in the existing research from these regions. Like, they probably wouldn't find many top-tier longitudinal studies that follow the same kids for years. And there are potential issues with measurement, how physical punishment was reported, who reported it, child or parent. The time periods covered could all vary between studies.
But they frame this not as a weakness in their analysis, but more as being transparent about the existing evidence they had to work with, right? They synthesized what was out there, using the best methods possible despite those inherent limitations.
Precisely. They use the best available data and analytical tools to give the clearest picture possible, given the challenges of researching this sensitive topic.
Okay, so bringing it all together then. This massive analysis, pulling evidence from almost 200 studies across 92 low- and middle-income countries, it gives powerful confirmation. Physical punishment is consistently linked to a whole host of negative outcomes for kids and teens.
Across behavior, health, relationships, development.
Yeah, pretty much across the board. And critically.
Critically, it found zero evidence of any positive outcomes. This suggests the harms are real, they're widespread, and really challenges that idea that maybe cultural context makes it okay or harmless.
And the consistency with findings from wealthier countries points towards a universal pattern of harm.
Seems so.
Okay, so for you, listening to this deep dive, given these findings, this clear evidence of widespread negative impacts, the complete absence of any positive ones, what does this all mean for families navigating parenting, for community supporting kids, for government setting policies, as we all try to create environments where children can genuinely thrive, free from violence and these kinds of threats? What are the most effective evidence-based ways forward? What strategies for support and prevention do we really need to focus on now?
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.